Hello dear friends, I Dr. Seda Sara welcome you all in Anatomy Student Zone with another exciting topic, that is pelvic wall and pelvic muscles. I know most of the students don't like reading muscle topic and they think it's just cramming, but again it's having great clinical relevance. If in future you are a surgeon or a gynecologist, you will come to know all about this. So here we go. The walls of pelvis are formed by bones and ligaments. These bones are partially lined by means of muscles, and these muscles are covered with fascia and the parietal peritoneum. So the pelvic cavity has an antero-inferior wall, two lateral walls, posterior wall and floor. Remember, the antero-inferior pelvic wall participates in bearing the weight of the urinary bladder. This wall is formed primarily by the posterior surface of body of pubic bone, symphysis pubis and the pubic rami. So the body of pubis bone is forming its wall posteriorly, symphysis pubis anteriorly and the pubic rami laterally. So the lateral pelvic wall are formed by means of bones, ligaments and the muscles along with the fascia that is covering these muscles. So the bones of lateral wall are right and the left hip bone. You can also see in this image that the hip bone are also having obturator foramina. So here the obturator foramina is also a part of lateral pelvic wall. And this foramina is closed, as all of you know, by means of a membrane that is known as obturator membrane. And the muscle of lateral pelvic wall is obturator internus muscle with its fascia that is going to cover that muscle. So it's quite easy to remember because this muscle take origin from the obturator membrane. Hence, it's a muscle of lateral pelvic wall. Now we will look into a posterior wall, or also some books have mentioned it as an posterolateral wall. So in our anatomical position, when we are holding this pelvis and we look into a posterior wall, it's made up of bones, ligaments and muscle. To understand this or to remember it in an easy way, you can say bones and the musculo-ligamentous structure are going to form this wall. So this is a sagittal section of a pelvis, and here the bones and the ligaments of posterior pelvic wall are shown. And we can see that the bones that form this wall, these are the sacrum bone and the coccyx bone. And the musculo-ligamentous structure that form the posterior wall, these are the ligaments, remember, which are associated with that of a sacroiliac joint, and these are the ligaments that are associated with that of piriformis muscle. The ligaments include, as you can see in this image as well, anterior sacroiliac ligament, another ligament is a sacrospinous ligament, another ligament is sacrotuberous ligament. So these are related with that of bones which are there going to attach. We can see a triangular shaped muscle also, that is a piriformis muscle, and this muscle is forming the posterior wall. So this is a muscle of posterior pelvic wall that is going to arise from a bone that is located posteriorly. So it is arising from the sacrum bone. In this image again the sacrum bone and the piriformis muscle is shown. Remember, this muscle arises from sacrum lateral to the pelvic foramina. As you can also see in this image, the pelvic foramina are shown, and the that is the muscle piriformis. It's arising from lateral to these foramina. So we will cover the detail of this muscle later on. So another wall of pelvis is inferior wall or a pelvic floor. Remember, the pelvic floor is very important. I will cover the muscles of the pelvic floor in next series. But right now, you have to remember this is a funnel-shaped pelvic diaphragm that is going to form the pelvic floor, and this diaphragm is formed by means of two muscles, and these muscles are coccygeus and the levator ani muscle. And the fascia is also going to cover this pelvic diaphragm that is known as the superior and the inferior layer of pelvic diaphragm, already covered in the pelvic fascia as well. As all of you know, the pelvic diaphragm separates the pelvic cavity from perineum. So the pelvic diaphragm forms the roof of the perineum because perineum is of course below this. So it's going to form its roof. Please remember, very important point over here, that the pelvic diaphragm attaches to the obturator fascia as well. So as you can also see in this image, that is showing the superior surface of the pelvic cavity. And this attachment of the pelvic diaphragm to the obturator fascia divides the obturator internus into a superior pelvic portion that is at the upper surface of a pelvic diaphragm, and the inferior perineal portion that will be the facing perineal portion. Now when you have covered the pelvic walls, how they are being formed, it will be quite easy for you to understand the pelvic muscle because these muscles are attached to these bones. So if you want to understand these muscles of the lesser pelvis, then divide them into two main groups so that you can easily remember them. So the first group you have already covered in a lower limb muscle, and this includes two muscles, which is the piriformis and the obturator internus. And the other group also includes two muscles which are forming the pelvic floor or a diaphragm, and these are levator ani and the coccygeus. So levator ani and the coccygeus, mainly levator ani of a one side combines with that of levator ani of an opposite side, and both these muscles are forming the pelvic diaphragm. So it is exactly like when you interlock your fingers of your hand, and it represents the intercalating fibers of two levator ani muscle. Now, before covering the detail of these muscles, I will tell you briefly how you can identify these muscles if you are going to do a dissection. So dear friend, you can easily identify these muscles on dissection. For this, just remember two bony points. First bony point is sacrum bone and the other bony point is ischial spine. So when you feel the sacrum bone, you can easily trace the origin of a one muscle, that is a piriform muscle, and you know this muscle was forming the posterior wall of pelvis. So the sacrum bone is located posteriorly, and on a posterior side, when we trace this bone, we can easily identify piriformis origin. So after originating from the anterior surface of the sacrum, the fibers of the piriformis passes through the greater sciatic foramina, and then it's going to be inserted on the greater trochanter of femur. So passing from greater sciatic foramina and inserting on a greater trochanter of femur. I will cover the detail of this muscle later on, but here remember these points. So another bony point that you can feel on a dissection is ischial spine. So when you feel ischial spine on dissection, here you can trace the fibers of the two muscles easily. And these muscles are coccygeus and the levator ani muscle, because these muscles are taking origin from ischial spine. So now we will cover the detail of these muscles. So first I will cover first group, and that includes the piriformis and the obturator internus. Now we have covered the much detail of piriformis, but whatsoever is left, and we will also do the revisit of previous one as well. Already covered, the piriformis muscle arises from the anterior or the ventral surface of a sacrum. So this muscle arises lateral to the pelvic foramina. We have also seen this. So after taking origin from the sacrum, it passes laterally. Now it's no more part of a lesser pelvis. So this muscle is leaving the lesser pelvis. So from where this will leave the lesser pelvis? It will leave the lesser pelvis through greater sciatic foramina, as we can also see in this image as well. So after this muscle leaves the greater sciatic foramina, it is attached to the greater trochanter of femur. And if I specify it more, I can say at the superior border of greater trochanter of the femur, this muscle is going to be attached. So you can also see in this image that the obturator internus muscle is also having the attachment at the greater trochanter of a femur. So in lower limb dissection, when you remove gluteus maximus, gluteus medius, you can identify the piriformis muscle, and also you can see obturator internus. These both are going to be attached over the greater trochanter of femur. Anatomically, we also observe a gap that can also be seen in this image, and this gap is present inferior at the inferior border of piriformis muscle. So what's the function of this gap? This gap allows the passage of a nerves and the vessel that are going to pass from the pelvis to perineum and lower limb or gluteal region as well. So about the function and the nerve supply of this muscle, I will tell you later on. That will be quite easy. Now we will cover another muscle of first group, and this muscle is also attaching over the greater trochanter of a femur bone along with piriformis, and that muscle is obturator internus muscle. As we know, obturator internus is a muscle of lateral pelvic wall. So the fleshy attachment of the obturator internus muscle covers the most of the lateral pelvic wall. And I had told you that the lateral pelvic wall includes obturator foramina, obturator membrane. And so the obturator internus muscle takes origin from obturator membrane. Besides obturator membrane, if the examiner asks you from where this muscle is taking origin, so it's also taking origin from a hip bone. So, but the which part of a hip bone? It's arising from the pelvic surface of ilium, and the ischium. This muscle also leaves the pelvis like that of a piriformis because it have to be attached over the greater trochanter of a femur. But what's the difference? The piriformis leaves the pelvis through the greater sciatic foramina, and the obturator internus leave the pelvis through the lesser sciatic foramina. And after leaving the pelvis, of course, they are going to insert or at the greater trochanter of a femur. So this table is showing the attachment, nerve supply, and the action of all these muscles in the both groups. We have covered just the first group, and look at this table. We can see the both muscle of the first group are acting at the hip joint, and both are lateral rotator of femur at hip joint. Regarding the nerve supply of first group, these are supplied by means of a lower limb plexus, that is sacral plexus. That was all about the pelvic wall and the muscles of the first group. I will cover the second group in separate lecture because we know the levator ani and the coccygeus are the muscle of pelvic floor, and the pelvic floor is having great anatomical and the clinical significance. Before I end this topic, I would like to tell you about an obturator fascia. So there are the few points regarding this. So of course, all of you know this is a fascia that is going to cover the obturator internus muscle. So at the superior and the medial aspect of this fascia, there is a gap, and we name this gap as an obturator canal, as you can see in this image as well. So function of this canal is to allow the obturator artery, vein, and the nerve to communicate between the pelvis and the medial compartment of a thigh. I have already told you about the tendinous arc as well in a pelvic fascia, and this arc is related to a obturator fascia. You have to remember this. So on a surface of obturator fascia, at which point the point is from pubic bone to ischial spine, this fascia is going to form a thickened band, and this we are going to name this band as a tendinous arc. That was all about pelvic wall and the muscles of the first group, and as I told you, I will cover the levator ani and coccygeus in next series. So till then, be happy, enjoy learning, but keep liking and subscribing this channel.